Assalamualaikum warahmatullahi wabarakatuh. Greetings to all judges and participants. My name is Anissa Witjaksono. I would like to express my gratitude for the committee for giving me this opportunity to present our study, the surgical outcomes of retinal glaucoma implant on primary open-angle glaucoma and juvenile glaucoma 1-year follow-up. Glaucoma is a multifactorial condition causes degenerative optic neuropathy. It is characterized by the loss of retinal ganglion cells and decreased visual fields. By the clinical characteristic, it was divided into two, the open angle and closed angle. However, in this study, we focus on the open angle, which is the primary open angle glaucoma and juvenile glaucoma. The difference between the two is usually in the age of onset. The juvenile glaucoma, however, from past study had shown changes in structure of trabecular meshwork, hence it usually came with a higher baseline IOP. The world prevalence of glaucoma is 3.5%, where 86% of them are open angle. In Indonesia itself, glaucoma is one of the leading causes of irreversible blindness, hence the needs of prompt treatment. One of the choice is using glaucoma drainage device. It was invented in 1969, has two types, the valve and non-valve. It has long improvement until the GDD that we are currently using. From past study, it shows that valve and non-valve had similar IOP reduction after 3 years. Retinal glaucoma implant or VGI was firstly introduced in 2016. It is the first and by far the only local Indonesian GDD, and it is in the non-valve type. As it's fairly new in the study, we're trying to measure the safety and efficacy of VGI in POIG and juvenile glaucoma subjects. The study is retrospective descriptive. It is conducted in Kirana Cipto Mangunkusumo Hospital with the study subject of POIG and juvenile glaucoma that came to our center. The inclusion if the study subject had undergone VGI surgery during 2019 to 2020. The exclusion criteria is as stated below. So from our inclusion criteria, we met 51 subjects. However, 10 of them had been excluded. So we have 41 subjects or 44 eyes analyzed in the study. 63% of our subjects are male, where 58 of them are in the POAG group. Most of them came in severe condition. The median age of our subjects are 49 and a half, which is quite similar to what past studies have reported. Our subjects had experienced previous surgery. Most of them had TREP and MMC or antimetabolites, which is supported by what Gede et al. Had reported. Usually after 5 years, TREP will fail, hence the need of GDD. So at baseline, the intraocular pressure of our subjects are 30 millimeter mercury, which is within the same range of what past studies had mentioned before. We found that in our subjects, the juvenile group had higher IOP in compared to the POAG group. After the surgery, our subject unfortunately had some hypertensive phase occurred at the 3rd week. This is quite different what past study had reported. While using the non-valve GDD, they don't usually experience hypertensive phase. This hypertensive phase stabilized at 2nd month in our subjects, and at 1 year, the IOP reduction is similar to what other non-valve GDD had reported, which is at 51% or 14 millimeter mercury, and it is statistically significant difference. We found no difference between the POAG and JOAG group in terms of IOP reduction. And with the reduced of IOP, we also found in our subjects the need of anti-glaucoma medication is lowered. In terms of visual acuity, we found that in our subjects, there was an increasing or improvement at 12 months follow-up around 2 Snellen lines, although it is not statistically significant different. And there were no difference between the POAG group and juvenile glaucoma group. The improvement of visual acuity had been reported before by past studies at around the same time of follow-up and around the same amount of improvement. Also, in our study, the cumulative success rate were 81%, which is kind of a bit higher than what past studies had reported. And in our study, the 7 subjects that fall into the failed criteria were due to the needs of additional intervention to lower the IOP, or unfortunately, they decreased the visual acuity to no light perception. There was no difference in success rate between the juvenile group and POAG group. However, we do found that the primary open angle group had almost 2 times more likely to fail, the implant to fail in compared to the juvenile group. Unfortunately, we experienced 38% of complication, or around 17 eyes. However, 11 eyes, or 65% of them, had been improved or managed by additional medication or surgery. The complication rate in our study is lower than what past studies had been reported. However, we still do have some limitation. This study is retrospective design, and only 60% of our subjects can be included until the final follow-up. But at the end, we do believe that PGI is effective as well as safe to be used in POAG and juvenile glaucoma patients. Thank you very much, everyone, for your attention. Wassalamualaikum warahmatullahi wabarakatuh.